So we've just come out of the panel discussion, thought-provoking one indeed. Give us some understanding there.
So we had issues that related to various aspects. The first was to questions of billing in private practice, always a very moot point. The dilemmas doctors face between what is in a patient's interest or what patients would like often doctors to do, which involves bending rules, sometimes breaking rules. The big question was, given that the state facilities are so poor, and you can't often refer to the state. I think the best example I can use is often, as people will know, if you're on a hospital plan, for example, and you need certain tests, and you can't afford to pay for them outside of hospital, and your medical scheme will only cover it in hospital. Then you ask the doctor to admit you, to say, let's get this expensive test done because you admitted to hospital. It becomes quite a problem because you're contravening the medical scheme rules or the hospital plan rules. At the same time, one, the patient can't afford it, and if you send them to the state, it's not going to happen, or it's going to take 6 months, 8 months. In the meantime, the patient's condition is getting worse. You need to make a diagnosis to treat. And I think the question, the maxims of the maqasid were brought to the fore in the discussion about necessity, the rura, what overrides, which maxim overrides the preservation of life. Does that override the other rule to say don't bend the medical aid rules? In this case, literally, given our public health system is so poor, and therefore the doctor is put in this awkward position of breaking the medical aid or the health, the rule versus ensuring that you are preserving the life of the patient or preserving the well-being of the patient. And it's a moral question, it's an ethical question, it's also a regulatory question. And these are some of the discussions that came out as far as that goes. Obviously, the question of billing is always a problem. The clear differentiation was made with what is fraud, and that is billing for things you didn't do or charging for services not rendered, and that is clearly unacceptable. The other issue that came out, what is the worth? Patients will often complain about doctors' fees, especially specialist fees. Sometimes a consultation can be 3, 4, 5,000 rand. There, the differentiation was made about worth. A plumber with a 6-month diploma can come and fix a bathtub or something like that and charge you 800 rand. A doctor who spent 15 years studying and ongoing studying has huge operating costs in his practice. For an hour will maybe charge you 4,000. What is the worth? And I think what came out there was the worth, what is permissible, but also the compassion that should come through from the medical profession for the people who can't afford those fees and who can't go to the state. And therefore, the whole emphasis, especially from the Islamic Medical Association point of view, would be to remind our doctors, to remind all our healthcare professionals about compassion and mercy, and ensuring that we provide that kind of subsidized service as well. The other very important issue came to what that was spoken about is what is allowed in our country versus what may not be permissible in the Sharia. And good examples that were brought, and very interesting examples, were what does a doctor do when an unmarried Muslim man or woman asks for contraceptives? Clearly, it is to be used for zina. And a very interesting discussion. Two things were brought up. One is, if you don't do it, will they change their behavior? If someone who's intending to commit zina, if you don't provide the contraceptives, two parts. Will they firstly go to someone else, which is fine, then go to someone else? But secondly, will it change the behavior of that patient? Will they stop doing it? And that was the question that was asked. No clear-cut answers. There were differences of opinions on how you should approach it. The one opinion that was proffered was, if you don't provide the contraception, the next step will be pregnancy. Then it becomes abortion, right? Then it becomes all of the complications related to an unwanted pregnancy. Which is the lesser evil? Again, a highly moral and ethical question to be asked. Similarly, with someone wanting to use to have facial surgery, for example, two types of patients. One is a man or woman who wants, for example, a nose job, just to look much smarter, much handsomer. The question was made, will you get the marriage proposal with or without it, etc. Then you have the other patient who also wants the nose job. There's no real medical indication, but psychologically the person is affected. So have body dysmorphic or let's say low self-esteem because the nose is slightly crooked and people are making fun of him or her, etc. We don't want to gender stereotype this and always say the ladies. Men are also these days highly conscious of aesthetics. What is the position of the doctor in that case? Two patients, they don't have scarring, it's just to look beautiful, but there's two different scenarios. One has mental issues over it, one is just perfectly fine but wants to look better. What do you do there? The other question that came up was when doctors are asked to make a plan. Right, constant problem. Mother and father on the medical aid, the child is not on the medical aid, but the child is very sick. Same problem. To send him to they can't afford. They're paying so much from their salary for the medical scheme and everything. No disposable income really to go incur high costs for the child's treatment. Sending them to the government is a nightmare. What does the doctor do? What is the overriding maxim here? To break the medical aid rules and see to the child and build the medical aid, or show the compassion and not charge at all? Treat the child, maybe your consultation free, then they have to go to the pharmacy, for example, or the tests. So you can do one part, maybe you can do your consult for free, but what about all the other tests, medication, x-rays, ultrasound, whatever else? So not straightforward questions. If you strictly applied medical aid rules, for example, then they're very straightforward. Is it permissible or not? When you apply the other maxims of the maqasid, preserving life, preservation of health, the well-being of the patient, becomes a bit of a gray area. So, like in all things, and I think the ulama will always usually understand there is a difference of opinion on many of these issues. There were abortion. Another huge topic, another huge issue that faces all of us in daily practice, unwanted pregnancies. Clearly, the abortions that are medicated, rape, the life of the child or the life of the mother is in danger, are separated from unwanted pregnancy because of promiscuity, etc., carelessness, contraception not done, etc., etc. And those are, again, difficult questions to answer. In this day and age, it's not uncommon. I have patients, gay, lesbian, transgender patients myself, who come in now want you to help them to change from a male to a female or female to a male. What is your position there? One, can you treat or can you then refer? Because you are aiding. The example that was often used is what we are clearly well aware of, and that is that as far as alcohol, is not only about who drinks or doesn't drink alcohol, the impermissibility of drinking it, but also producing, manufacturing, transporting, selling. So it's a whole chain. And here, even if you refer, how much are you aiding and abetting the patient in committing sin? Where is your responsibility in helping someone to commit sin, abortion, change their sex, just because they feel they're in the wrong gender, zina with contraception? So those are the interesting questions that came up. What I think the suggestion that was made at the end, which is an excellent suggestion, as the IMA, inshallah, we will be taking it up, is to set up a separate committee of the IMA dealing with fiqh issues, and now to sit with the ulama and to have ulama who now specialize in these medical, legal, bioethical questions. Alhamdulillah, we do already have a few doctors who have done alim courses, and that helps to bridge the gap between the medical fraternity and the ulama. But I think it will be good to have a dedicated panel of doctors who know what's on the ground, who know what the questions come up, what are the issues facing healthcare professionals, to bring them on board and to look to our various jamiyats and say who are the ulama who specialize, or now to encourage the specialization of these issues. I mean, the future is even worse. I mean, AI. Now, as people know, there's cloning of genes. There's all sorts of technology now to mix animal and human genes. And that is the future, what is going to happen on those issues. So it's a huge area for future fiqh issues, not just what is existing, but what is going to come, especially now with the ability to interfere with the DNA, to clone genes, etc. So I think at the end, that body, that panel that we put together between the ulama and the medical fraternity will be crucial, and inshallah it's something we'll be taking up.